Have you ever run your fingers through your hair and discovered it wasn't attached anymore? Hair loss can be distressing, especially for women. Today on Healthy Looks Great on You, we explore causes, cautions, and hair loss connections to nutrition, medications, and more. When I was in medical school, my 20-something-year-old cadaver lab partner was mostly bald. After a leave of absence for personal reasons, he came back with a full head of gorgeous hair. What is the secret? To be honest, I think he had a hair transplant. And that's about the extent of what I learned about hair loss in medical school. Oh, except that your hair gets brittle with thyroid issues. Come to think of it, in my OBGYN practice, I had lots of women who expressed concerns about hair loss. And if they were postpartum, I'd reassure them it's normal. Otherwise, I'd check their thyroid levels. And if those were normal, the nurse would call them and tell them everything is fine. Yeah, sorry about that. Today on the podcast, I'll tell you what I'd tell them if I knew then what I know now. I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved. Today we start with a pop quiz. How many hairs can you lose in a single day and it's still considered normal? You might be surprised that up to 150 hairs packing up and vacating your scalp is perfectly normal. While this may be noticeable to you because it's swirling the drain in the shower, normal shedding isn't noticeable to others because new hairs are growing back. Let's go to mini medical school and learn about the 4 stages of hair growth. A is for anagen. This is the active growth phase. Think of a plant that's sprouting up through the soil, except on your scalp, this phase lasts 2 to 7 years, and most of the hair on your head is in this phase. Then it stops growing. The follicle under your scalp shrinks and shrivels over the course of a couple of weeks, and it no longer has a blood supply. Only a small percentage of your hair is in this transition state called the catagen phase. Then the follicle beneath the surface just sits there and rests for about 3 months before shedding. The dormant period is called the telogen phase. And when it says farewell to your scalp and actually escapes down the drain, that's called the exogen phase. Most people do shed about 50 to 150 hairs every day in the exogen phase. You probably wish the hair exit was closed, but sometimes they go rushing out like there's some kind of emergency. Yeah, I won't even say your hair is on fire. And it turns out that severe emotional or physical stress causes follicle growth to slow down. And they rest, which truthfully might cause more stress. But this type of sudden hair loss is called telogen effluvium. It has an identifiable cause. Lots of sudden weight loss or surgery can trigger this condition, as well as any severe illness with fever and COVID-19. The good news is that even though it can be drastic, it's temporary. The hair will grow back, usually in about 6 months. Hormones can trigger anything, but hormonal shifts also affect hair. The most common reason my patients had significant hair loss was postpartum shedding, about 3 to 6 months after delivery. And it happens because estrogen levels plummet after delivery. And all those hairs that were growing like crazy because of the elevated estrogen during pregnancy, which prolongs the anagen phase, suddenly enter the telogen phase all at the same time. And that can be dramatic. And it takes a while for those new hairs to fill in the gap, but eventually things do get back to normal, unlike a lot of other things that come with motherhood that don't get back to normal for 18 plus years. The same thing can happen with any hormonal changes, like stopping or even changing brands of birth control pills or types like implants or patches. Stopping breastfeeding or polycystic ovarian syndrome and menopause can trigger hair loss too. And that can be more permanent They don't call it the change of life for nothing. Another more permanent cause of hair loss is autoimmune conditions like alopecia areata, where your own body attacks the hair follicles, leaving round patches of hair loss. And that can even progress to total body hair loss. You may have heard of this condition because there are some famous people who've openly discussed their struggles, like Jada Pinkett Smith. And surely I don't need to tell you that if you notice bald patches, you should see a doctor. But since my OBGYN training did not really prepare me, I'll give you a hint. The expert is the dermatologist. The scalp is in their wheelhouse, and there are now FDA-approved JAK inhibitors that show promise for severe cases. Plus, you might actually have another condition like ringworm causing circular bald patches. This one is usually accompanied by scaling and itching because it's actually a fungus and not a worm. However, it's a lot more common in kids. Both of the conditions I've discussed, telogen effluvium and alopecia areata, affect both men and women. So does androgenetic alopecia, and this is actually the most common cause of hair loss. And as the name implied, it's hereditary. And instead of sudden patches of lost hair, this hair loss is more gradual and shows up as a receding hairline or baldness at the crown of the head in men. And in women, androgenetic alopecia is called female pattern hair loss. And unlike men, women typically keep their frontal hairline even as their part widens. This can happen in any age, but is most common after age 40. And androgen sensitivity, not necessarily androgen levels, is the driver. So women can have completely normal lab work and still experience it. You know, Jesus said to his disciples, "Indeed, the very hairs of your head are all numbered." Now stay with me just a minute. When we get to heaven, we aren't going to be sitting around playing the harp. We're going to be doing work that is fulfilling. Personally, I don't want to count hairs, but I just wonder if that would be heaven to some accountants. Hey, at least they wouldn't have to deal with tax season, right? Because tax prep is enough to make you want to pull your hair out, which is actually a medical condition called trichotillomania. You want to know what else can pull your hair out? Traction alopecia, which comes from ponytails and pigtails and barrettes or cornrows that are really tight. Certain chemicals and treatments like hot oil and perms can cause hair to fall out, and get this, it can cause scarring and make it permanent. Last summer, my hair was terrible. It was broken right straight across the back. It turns out that my ponytail was bumping up against my golf hat and breaking my hair. You also need to be careful with dryers and curling or flat irons. Use a detangler and brush your comb hair gently, especially when it's wet. And even sunlight can damage your hair. About 3/4 of all hair loss can be attributed to androgenetic alopecia, telogen effluvium, and alopecia areata. But that still leaves room for us to talk about the role of nutrition. Deficiencies in B vitamins, especially B3, can cause hair loss, but that's really rare in the United States. Deficiencies in iron, vitamin D, zinc, biotin, or protein can disrupt hair growth cycles because they're all necessary for producing keratin and keeping the hair follicles healthy. Vitamin D is necessary to create the cells that develop into hair follicles. And people with alopecia do frequently have a vitamin D deficiency. The most common nutrient deficiency that causes hair loss is iron deficiency. Your blood needs enough iron so that your hair follicles get the oxygen they need. A vegetable that is highest in iron is spinach. And if you listened to last week's podcast episode, you know that I have an overflow of spinach at my house right now. So come and get it if you need a boost in iron. Beans and lentils are also good sources, and if you eat foods that are high in vitamin C, that helps your body absorb iron better. And you need vitamin C as well as vitamin A. They're important in collagen production as well as sebum, and that's that oily stuff that comes out of the sebaceous glands that are located in the scalp. Wait, did I say collagen? What if you just put some in your coffee and drink it? Some people swear by it. But do these supplements work? Good question. Collagen plays an important role in healthy hair because it has amino acids like proline and glycine that are needed for keratin. And as you get older, collagen levels decline. That can cause thinning hair, as well as breakage, and of course, wrinkles to boot. Which is why we're always looking for a collagen boost to hydrate skin and hair and make it more elastic. And it sounds great, but the research is pretty iffy, especially when it comes to significant hair loss that is attributable to a specific cause. The same is true for biotin. You need it for keratin, and it's found in egg yolks and nuts and seeds. But research on supplements isn't terribly convincing. More concerning, biotin supplements can interfere with certain lab tests, including your thyroid panel, as well as troponin, which is a marker for heart attack. So if you're taking a biotin supplement, be sure and tell your doctor. Rather than taking supplements at random, the best plan is to have your levels checked and treat specific deficiencies with targeted therapies and doses. And look, excess vitamin supplementation can be harmful to your health and actually cause hair loss, especially selenium and vitamin A. Selenium toxicity from oversupplementation is a real and under-recognized cause of hair loss. And it's important to caution you about vitamin A toxicity. Isotretinoin is a vitamin A derivative that's used to treat acne, and it is a well-known cause of telogen effluvium, and it's also not safe to take prenatally. And it's always better to get your nutrients from food. Zinc and selenium help repair tissues and keep those oil glands around the follicles healthy. These micronutrients can be found in pumpkin seeds, whole grains, and nuts. There are lots of vitamins and minerals that are needed for your hair, but deficiencies are really rarely the cause of hair loss. Keratin is the main ingredient in hair, and it's a protein. So if you don't get enough protein in your diet, that can make your hair brittle or thin from shedding. This most commonly happens after rapid weight loss or with a major illness. You can get enough protein and better quality protein from plants, especially soy, but also eggs, lean meats, and fish are good sources. Vegetarians are more prone to be protein or iron deficient, so it takes some effort. There are some prescription medications that may cause hair loss too, like certain blood pressure medications, heart medications, arthritis medications, and depression medications. Blood thinners, especially heparin and Coumadin or warfarin. Even some types of hormone therapy can worsen hair loss, especially testosterone. And mood stabilizers and anti-epileptics, especially valproate. And of course, one of the common side effects of chemotherapy is profound hair loss. Now, one thing that potentially helps with this is a cooling cap. So if you're going to undergo chemotherapy, be sure and ask your doctor about that. Do get your thyroid checked because sometimes that is the cause. Whether it's an underactive or overactive thyroid, that can affect your hair. So it's worth getting a full thyroid panel. If you want healthy hair, talk to your doctor. If your blood work is normal, see a dermatologist. And there are some products that work to some degree, at least while you're taking them. Nutrafol is the most commonly recommended for women. It's an over-the-counter supplement and not a prescription. Some women may find it helpful, but know that the studies are primarily funded by the manufacturer. Minoxidil, also known as Rogaine, can be used by both men and women, and it's available over the counter for topical use, and there's a low-dose oral form available by prescription. And of course, transplants are effective. You know, healthy hair is great, but even without it, if you're struggling with thin hair, still, healthy looks great on you.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.